Hello everyone, and welcome to this audio podcast. Excuse me. This audio podcast, as part of a Phantom edition. This audio podcast is part of a Vertex Roulet, and this audio podcast is part of a Lobostics Machina. This audio podcast as part of a Storm Lobostics production. In a part of the International Pediatric Transplant Association, IPTA 2022. A research poster presentation had been put forward in regard to using the internet and online methodologies for data collection, and where the research poster presentation looked at a sort of a retrospective review. The research poster presentation was collaborative between an academic institution in the United Kingdom and two social media platforms: the Renal Patient Support Group, the RPSG, and the Kidney Disease Support Group, or KDOS Group for Kids. So to begin with, some understanding of aims. So the aim here was to conduct a retrospective review of one, online methodologies for qualitative and quantitative data collection in research, and two, explore consent and ethical issues, and three, implications for prospective or future practices. Now, looking at some background to this research poster presentation. So, research using the internet or the World Wide Web provides unparalleled opportunities for subject access, and it is not limited by constraints of time and geography. Qualitative work aims to convert visual or narrative data into non-quantitative outcomes, i.e., or for example, questioning in regard to the what, the why, and the how, but not how many or how frequently, as is characterized by its own distinctive vocabulary, which reaches across healthcare specialties. The qualitative data collection model aims complement quantitative investigations by producing records of semi-structured dialogue or focus group conversations or observational research or film capture, for example, documentary, inquiry, or survey. An example relevant to some research that have been conducted in regard to a specific form of cancer, for example, was where research looked at where investigators interviewed in regard to an interview-based investigation where investigators looked at the experience of NHS, the National Health Service care and treatment in lymphoma recipients. In lymphoma recipients, and where the research had been carried out by investigators in around 2011. As an example, data collection had become increasingly important to for example, nursing and allied health professional, or AHP, research. However, the emphasis on evidence-based medicine, or EBM, together with recognition of the importance of quality of life, has prompted healthcare professionals of all specialties or disciplines to acknowledge the value of qualitative methodologies or methods. Which can provide a dimension of data relating to experiences, attitudes, and beliefs in order to inform and develop better healthcare strategies. Now looking at some of the design and methodology as part of this this research poster presentation. In regard to this research poster presentation, two searches were carried out. One using PubMed Central, and Medline databases, and two using EBSCO host engine, searching Signal Plus, Psychology and Behavioral Sciences collection, Health Source, Nursing and Academic Edition, International Bibliography of Social Sciences, SOC Index, Full and Sci Info between around 19 between the mid 90s 1995 and up to 2013 in both cases. Main terminologies to search the databases included qualitative research, quantitative research, online and data collection, World Wide Web, Internet, and a critical appraisal skills program, or CASP tool was utilized to help analyze different publications accordingly. In regard to the analysis or the synthesis of results. So after abstract quality appraisal, 54 publications were identified as being relevant to this works, or to the review from one from search 1, and then 19 publications from search 2. From the abstracts, 5 research themes were identified. Findings indicate that internet research expedites outcomes when compared to conventional methodologies, and it is a practical alternative for interviewing, validating measures, and studying or investigating populations, investigating in amongst different populations. However, only 10 of the publications reviewed involved the implementation of online methodologies to collect qualitative as opposed to quantitative data. The variety of World Wide Web media platforms allows greater scope for the collection of qualitative data in respected and variety of research specialties. The privacy that the internet questionnaires improves data by reducing response bias. Confidentiality is believed to prompt assurance in participants, enabling them to reply to delicate questions more openly, reducing reply partiality and investigating inclined preference, thus improving the truthfulness and factual content of exchanges. This applies to quantitative questions, providing methods of metric data analysis, and providing methods of metric data analysis have proven quality and provenance. For further reading, there is works by Griggs and team from 2011 who provide from Griggs from 2011, who provides an evaluation of the internet as a medium for gathering gathering ethnographic data, for example. In regard to the as part of the themes, as part of the themes and the as part of the analysis or the synthesis of results, as part of the synthesis of results and the analysis. Now looking at sort of themes, the themes that have been derived as part of this research poster presentation from 2022. So theme one, using different media to collect data. So online research methodologies allow scope for investigators to create web pages to collect data from specific and diverse populations. And to readily save data in text format for importing into secondary data analysis programs. Works going back as far as 2004, for example, by Kanzaki and team in 2004 and 2004 provide an example of an investigation using World Wide Web data collection to gather qualitative and quantitative information related to daily coping experiences of Japanese recipients with rheumatoid arthritis. The investigation used or utilized an online survey delivered by email and the use of e-diaries, which were submitted by respondents through a personal blog, giving access to both patient or recipient and investigator for interaction and analysis. The approach recommended by future for future research with recipients with long with this approach was also has been recommended for prospective investigations with recipients with long-standing conditions such as chronic kidney disease, or CKD. In regard to theme two, looking at maximizing responses. So online surveys and questionnaires consist of structured and closed questions and can be posted to news groups, email lists, emailed directly to participants, placed on a website using an email link, for example, or providing an uncomplicated universal resource locator or a URL, permitting better survey distribution to larger audiences. And when compared to postal questionnaires, internet, email, or surveys give increased response rates whilst reducing the risk of multiple responses from individuals, greater speed and advantage of asynchronous communication and the absence of intermediaries. There is growing body of literature, or there has been a growing body of literature relating to and regarding to online data collection, and guidance is now readily available, where publications from in around 2009, between 2004 and 2009, inform of some of the evidence base in regard to the growing literature and guidance documents in regards to the use of in regard to the approach in regard to the approach and surrounding data collection, online data collection, and in regard to the use of and how to in regard to how to use online data collection. Now, in regard to theme three, using the internet to collect data, validity and reliability. Researching populations that are difficult to reach can be challenging. It is important that whatever the data collection methodology, the design and purpose of the investigation is reliable and effective for the target group. Several authors focus on reliability and validity when using online facilities to retrieve information. The advertising of research with an internet platform can encourage volunteering. By a genuinely intrigued participants, thereby enhancing the value of research outcomes and broaden the range of participant backgrounds, as seen with sufferers of chronic illnesses. or chronic illnesses. The validation of online data collection research should involve a comparison of internet and traditional information sources to identify participant bias. In regard to theme 4, looking at ethics and confidentiality, an investigation into lifestyle in a small group of participants in research from retrospective research from around 2007, investigator Atkinson and team in 2007 look at sort of lifestyle in amongst a small cohort of those suffering with colon cancer, colon cancer, and assess the feasibility and comparability between face-to-face versus online communication. Throughout this investigation, a study coordinator could be contacted by email and telephone to answer additional questions about the protocol and confidentiality. Findings indicated that internet mediated or IM chat focus groups for ill or disabled participants can be more acceptable for disclosing sensitive information than face-to-face focus groups. For example, in considering confidentiality, it is important to bear in mind that focus groups are using traditional methodologies. Although participant privacy can be maintained, research may not supply sufficient detail where delicate or individual themes or manners relating to social divergence are required. Using either a traditional or online or using either traditional or online approaches, the group a leader or moderator may face a similar challenges, encouraging vocalization of all viewpoints. A final theme, of theme five, theme five, looking at advantages and disadvantages and limitations. So, internet access is becoming more accessible to the general population at gradually reducing cost. The global expansion of broadband networks is rapid, for both reasons, access for participants is becoming less of an issue for online investigators. The most critical limitation to the success of internet research is the satisfactory design and preparation preparation for research projects, which makes the communication of actions and choices to participants clear, consistent, and transparent. Several investigators or authors report on disadvantages and limitations of conducting online investigations. Works by Bergman and team in 2008, Fox and team in 2007, Guys and team in 2007, and Sutter and Klein in 2007. And now looking at sort of advantages of traditional face-to-face focus group versus online focus group methodologies. Wherein the research poster presentation, there is an overview that looks at a sort of a comparison, looks at a sort of a sort of compare and contrast, from adapted works from Kramish and team in 2001. So, regards to traditional face-to-face focus groups, there can be more expansive communication. So, for example, narrative and stories, where narratives and stories exist, and in online focus group, it can be less. There can be less digression. There can be less digression, and less digression due to brevity, brevity, and in regard to traditional face-to-face focus groups, there's visibility of body language, which allows moderators or investigators to pick up on signs of emotions, for example, anger, discomfort, which would remain sort of hidden in online in through online formats in online focus groups. There there is an increased willingness to share, and there can be an increased willingness to share and discuss sensitive issues due to the greater desire to communicate. Online chat, for example, allows audiences can allow audience to join in communication. In regard to traditional face-to-face focus groups, meeting site is it tends to be meeting sites tend to be set in a convenient or local areas, and in online focus groups, for example, transportation and ability to follow directions to meeting site parking become non issues. In regard to traditional face-to-face focus groups, participants are presumed to reflect views like those who are involved who are or would be involved in investigations, and traditional face-to-face focus groups allow verification of face-to-face participant and same of allow verification of face-to-face participant in the same geographic within the same geographic area. However, a study or investigation may want different people to represent different ideas. Traditional focus group interactions do allow all verification of all participants, but not all may want to participate on the same day. In regard to online focus groups, a wide or broad geographic area can be reached, and this allows verification of face-to-face participant concerns and viewpoints as local or more global. In regards to traditional face-to-face focus group, there is also more group interaction and where a group dynamic can exist. In regard to online focus group, there's less chance of dominance by one person with a sort of a round robin approach. In regard to traditional face-to-face focus groups, there is the internet or World Wide Web, for example, is not required. In online focus group, there is or can be easy access, especially if a computer within working or sort of within environs within sort of environs where the internet is accessible. In regard to traditional face-to-face groups, traditional face-to-face groups may also be more may also be a more sort of appealing way in recruiting an ethically diverse population, because there may be issues with there could be issues with, for example, computer literacy or dilemmas understanding using the internet using internet and computers. In regard to online focus groups, physical health and symptoms or symptomologies and ability to travel are not deterrents to participation. Now looking at some conclusions as part of this research poster presentation from 2022. So the review identified 73 papers or publications using two searches, but only 10 but only 10 publications reviewed the implementation of online methodologies to collect quantitative data. Findings highlight that the internet offers novel opportunities for investigators across specialties. Collecting quantitative research data has entered a new as well a new era. There's freely available software, and a range of IT applications permit new opportunities and greater flexibility in the development of research investigations. However, data comparison continues to require a blend of both traditional face-to-face and online methodologies. Online data collection for health research includes advantages of increased participants of subjects in for example of participants for example in amongst the minority ethnicities and or hard to reach populations, investigating sensitive issues and gathering data from populations otherwise populations otherwise dispersed. So for example, people with low incidence conditions or and or disabilities, um, and or disabilities uh, 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 and or disabilities. And finally, it is vital that investigators or researchers using online data collection adhere to strict ethical principles and develop new guidelines based on experience. That draws this audio podcast to a close. This audio podcast as part of a Phantom edition. This audio podcast as part of a Vertex Roulet. This audio podcast as part of a Lobostics Machina. This audio podcast as part of a Storm Lobostics production.